Hello, Dr. G, formerly Dr. M. I'm not going to use any names here, your name or the patient's, but I will tell you verbally when we speak later who it is. So here's what we've accomplished so far. You can notice that there was a lot of maxillary constriction, which led to crowding. And this is where we are now. So we've almost completely corrected the crowding. Still a little bit of work to do. Almost always when you finish an Invisalign case, as you know, like this tooth was out a lot, it's out a tiny bit. This was out, it's out a tiny bit. So from this view, to complete the alignment, very simple to achieve. I'm going to come back to the upper in a minute. The lower was kind of mirroring the upper, and look at how nice it looks now. We just got to get that a little broader and more aligned. But here's where we need to make a decision. And here's where I'm a little bit stuck. So the patient has expressed an interest in wanting to take care of these little chips. They are not willing at this point to do veneers because they perceive that it is going to be irreversible and maybe excessive in their point. And I'll send you pictures because the smile happens to look pretty nice right now in terms of the color and opacity and character of the natural enamel. So I think she's leaning towards doing bonding. Now, the gingival margin is lower on one tooth than the other. And the patient sent me a video where she actually acted out her different smiles. So when she laughs, she has a lot of gum display, not a lot, a little gum display just in this area. When she smiles, she doesn't show it at all. And when she speaks, she doesn't show it at all. If this was a veneer case, and if it was a much higher lip line, I would advocate trying to intrude these incisors more. But I think the patient is anxious to be done and anxious to get the edges restored, and at this point wants to keep it kind of simple. So I'm going to send you the pictures, and here's my question for you. If you're going to do bonding, is there any advantage to doing this from a standpoint of bulk of restoration? I would kind of think that since bonding can break, if we were able to achieve this and then the bonding did break, it would be a little bit more disconcerting to the patient until it could be repaired. Whereas if you're just doing a real thinner repair of these two teeth, then I think if it were to chip, it wouldn't be as noticeable. So I don't know if that's thinking negatively or if that's thinking smartly. So that's my question for you. We know intruding these would help with the gummy laughing smile in that area, but the patient isn't that concerned about that. And so what do we do? Should we intrude these or for now leave them the way they are and keep it simple? Which is better for the bonding? Let me know.